Hello, Dr. Gelota. First, I would like to apologize for sounding congested. My family and I are currently fighting off recovering from COVID, having tested positive for it. So I just want to apologize for that. And then, second, I would like to say thank you so much for having me in your class. I have really enjoyed it and I've learned a lot. Um, Although I do wish that we could have had class face to face, but I guess that's life. I'm going to go ahead and get started. So here we go. Hello, my name is Ashley Stuckey, and today I'm going to be teaching you about lupus. So, what is lupus exactly? Lupus, currently, there is no known cause for lupus, but we do have an idea of what it is. Lupus is a long term autoimmune disease that attacks its own tissues, causing inflammation and damage to many organs. It more commonly appears in women aged 15 to 45 years old, but all ages can be affected. There are certain racial groups that are affected by it more than others. These racial groups are African Americans, Hispanics, and Pacific Islanders. People who have family members that have lupus are more common to get it as well because it can be genetic. Lupus is found in every 9 out of 10 women, with only 1 out of 10 of men. When lupus develops, it is quite similar for both males and females. The lifespan for someone with lupus can be the same as someone without it, and some can live with this disease for 40 years or more. So, what does lupus do to the body exactly? Well, let's start with the nervous system first. Lupus may affect any organ of the body. The central nervous system is affected, as well as the peripheral nervous system. When the brain is attacked, it is called neuropsychiatric SLE. When lupus attacks the brain, it is hard to know if it is from the disease or caused by another health condition. The organic brain syndrome is referred to as an impairment of the brain caused by lupus. To check if this problem is due to lupus, a spinal tap is conducted. When the nervous system is attacked, it can be caused by antibodies binding with nerve cells or even blood cells. Lupus can also interrupt the blood flow for the nerves. When the nervous system is affected, patients may experience clouded thinking, confusion, and sometimes even memory loss. Some patients can experience depression and anxiety as well. Um, At least 50% of lupus patients experience lung problems. Lupus attacks the lungs by causing four specific conditions. Pleuritis is one condition where the pleurae, which is the membranes that surround and protect each lung, become inflamed, which can cause painful breathing when you take a deep breath in. Acute lupus pneumonitis affects 1 to 10% of patients. This causes chest pain and dry cough, and sometimes people cough up blood as well. This condition requires immediate treatment, such as a steroid given, something like prednisone. The lungs can end up scarred. Being left untreated, it can turn into chronic lupus pneumonitis, which is a more severe condition. Pulmonary hypertension is one of the most severe lung conditions caused by lupus. It occurs in about 10% of people with lupus. Pulmonary hypertension is when the blood vessels that carries the blood from the heart to the lungs is thickened. Which it reduces the amount of blood that can actually pass through. This not only affects your lungs, but it also affects your heart as well, because your heart is working harder and faster to pump. When the heart struggles to keep up, your body experiences lack of oxygen, which is also known as hypoxia. This condition rarely responds to lupus treatments such as immunosuppressives. Skin conditions are shown in most patients suffering from lupus. Some skin conditions that patients can experience are sensitivity to the sun, which can make the skin flaky, red spots on the skin, and a purple rash. The skin will go through phases where it looks kind of scaly like a reptile when reptiles are when they're shedding their skin. It'll start to peel like that. The skin can become itchy and dry. It is important to see a dermatologist who can help the skin turn. It's important to see a dermatologist who can help because the skin can turn to eczema, which, knowing from my experience, oatmeal baths is really good, and Aveeno oatmeal. Conditions of the skin also take up 4 out of 11 criteria to diagnose lupus. The kidneys. The kidneys are greatly affected by lupus, and the most studied affected organ. The most targeted part of the kidney is part of the nephron called the glomerulus, which is the tuft of capillaries that functions is to filter the substances from the blood. The kidney does not filter right during this lupus process, so it'll cause protein and blood in the urine. The kidney becomes inflamed, which the kidney is damaged, and this is what the doctors call lupus nephritis. There are 4 types of lupus. The first is systemic lupus erythematosus, which is also known as SLE. SLE is the most common form of lupus. The second type is cutaneous lupus. This is where the immune system attacks the healthy skin, and one of the main symptoms is the malar rash, which is also known as the butterfly rash. Sorry. The drug-induced lupus is brought on by certain prescriptions, one of those prescriptions being hydralazine, which is used to treat blood pressure, hypertension. 2 more are procainamide, which is used to treat irregular heart rhythms, and isoniazid, which is used to treat tuberculosis. The final type of lupus is the neonatal lupus. This one's one of the sad lupuses too. It affects the babies of women that actually have lupus, and it's a very rare type to have. This type of lupus is presented at birth with babies and having a red rash. These rashes, along with liver problems and a low blood count that may occur, but it can subside about 6 months. Signs and symptoms of having lupus. People with lupus experience many different symptoms, and they vary from person to person. Lupus patients may experience extreme tiredness and joint pain. Lupus also causes things like muscle aches and joint aches. Usually the doctors can't really do anything about it besides either you can go see a chiropractor or they can prescribe you a muscle relaxer like baclofen. Patients that live with lupus can also experience severe chest pains and shortness of breath. Mouth sores and nose sores are a main sign of lupus. The lupus flare-ups also happen frequently, especially when the patient's experiencing stress. Lupus flares can happen basically out of nowhere as well. Sometimes it starts attacking your body for no reason. It's like a ticking time bomb, basically. Men experience these same symptoms, except for the fact that they're more prominent in men than they are in women. Most lupus patients experience confusion, migraines, and brain fog. Hair loss is also caused by lupus, as well as medications like hydroxychloroquine, which is used to treat lupus as well. Some may experience unexplained fevers and even weight loss. How is lupus diagnosed? Well, there's no real exact test to diagnose lupus. It's pretty difficult and it can take many years. A lot of times, patients are actually misdiagnosed because they may experience the same symptom compared to another autoimmune disease because a lot of them have similar signs. So there is no specific test that can say whether someone has this autoimmune disease or not. In order to diagnose, the doctors have to look into both your medical history and your family history because, like I said before, it can be genetic. Doctors also have to look at the symptoms that the patients are having, and they go over all the lab tests as well. Some tests that the doctors look at are things like complete blood count tests, which analyze the red, the white, blood cells, as well as platelets. A blood chemistry panel is ran to evaluate 7 to 25 different blood components individually. This helps the doctors see the kidney, the liver, thyroid, blood cholesterol, and the glucose levels. They do a urinalysis, which checks different aspects of your urine. This helps them identify things like the amounts of protein in your urine, or if you have a urinary tract infection, as well as the amount of blood that is getting pushed out into your urine. They also run an ANA test. This is an anti-nuclear antibodies, which is found in the blood of one who actually has this autoimmune disease. It can also be an indicator for different autoimmune diseases as well. So there are 11 main criteria that doctors can use to help diagnose lupus. The doctors begin with looking for the butterfly rash, which this goes up your cheekbones, kind of like the wings would, and then it goes over the bridge of your nose, like the body of the butterfly. Most of the time, it feels really hot in your face, and it's pretty red. The second thing is a skin rash that is made of raised red patches on your skin. Another thing is that they look for is a strong reaction to sunlight. That doesn't usually happen in people who don't really have this autoimmune disease, but it does lead to things like rashes on the arms and the legs, your chest, and your face, which is the butterfly rash. A flare is when the lupus symptoms begin to worsen, and they can be described as like a flu-like symptom with a fever. Another indicator are ulcers found in your nose and in your mouth, which can be painful. The fifth thing that they look for is arthritis in about 2 or more of your joints, while the next thing is inflammation of the lining of your lungs and your heart. Neurological disorders that can indicate lupus are things like seizures and psychosis, which affects how the brain process works and how it processes information. Kidney disorders such as increased protein amounts and red cell clumps in the urine and blood disorders such as anemia are found in lupus patients. Iron deficiency anemia can be caused by the body's lack of ability to absorb iron the way that it should. It can also cause low levels of the mean corpuscular volume, which indicates the red blood cells are smaller than normal. The mean corpuscular hemoglobin, which is the amount of hemoglobin per red blood cell, and the hemoglobin levels, which indicates low blood. Another cause is not eating the proper foods that are high in iron. So things like cream of wheat, you can eat that. Lupus patients actually have to stay away from things like red meats, which are high in iron because they cause inflammation in the body. Immune disorders are where the immune system attacks healthy cells. It's a huge thing for the doctors to look at since lupus is an autoimmune disease. The final thing that the doctors look at are the ANA tests, which have to be positive without being caused by drugs like the hydralazine. Treatments and medications. So there's no cure for lupus. There really isn't, and it can be really hard to deal with. It's really hard to live with as well, but some people live a normal, healthy life. But there's definitely ways to manage it, although it may vary between person to person. Some patients can take one medication that one may not be able to take due to their side effects. Some doctors prescribe like anti-malarial drugs. One anti-malarial drug can be used to treat lupus is hydroxychloroquine, which gathers in lysosomes in order to stop important function through increasing pH, which it's been seen to be effective in SLE patients. Hydroxychloroquine is also used to protect the kidneys. and other internal organs, and can add an additional 20 years onto your lifespan. I discontinued taking the hydroxychloroquine due to it caused me stomach pain, vomiting, and it really messed with me emotionally and mentally. So I had to discontinue it. But with that being said, this is a great treatment for those who are experiencing kidney function problems. And like I said, it just kind of varies between patient to patient. A chemotherapy drug known as methotrexate uh, that is used to treat cancer patients, um, but it's also a method used to help treat lupus patients as well. Methotrexate is typically used to stop the growth of cancer cells and bone marrow cells and skin cells. But it just that one that medicine's given depending on how bad the lupus is. Um, and then they have prednisone. This is the most common steroid used to help treat the inflammation portion of lupus. There's many different medications that can help treat lupus. You just really have to find the one that works best for you, and it can take some time, but um, eventually you'll get there. Dangers of not treating lupus. If someone's lupus goes untreated, it can lead to life-threatening complications. So depending on the severity of the active lupus, the person can experience things like strokes and heart attacks, um, which is why it's very important to monitor your lupus. Back in the day, when there were no medications to treat lupus patients, their overall 5-year survival rate was less than 50%. But whereas today, it's actually a 95%. So a lot of people are doing really good considering that they're taking their lupus treatments. Well, that concludes my presentation today on lupus. I would also like to say to those currently fighting lupus that you're not alone, and that there's help out there. There's support groups that you can look into, and you shouldn't feel ashamed or embarrassed about battling this lupus condition. And just remember to keep your head up, because not only are there treatments, but you can live a good and healthy life if you do take your treatments. So that is it. I would also like to say that I too am a lupus fighter, and I'm in a support group as well. And there's sometimes talking to strangers can really help you. So thank you, and I hope you have a great day. Bye.